Could you give us a brief overview of the Digital Health Catalyst and the problems that you're trying to solve through it?
So for digital health, we've added some new use cases because we've been working on digital health for a few years, working through the business model canvas and defining the business problems. But we've come up with a new use case. So instead of our original use case was care at home and the usage of devices to get monitored data, we've now added a use case for well-being at home. So it's more about the patient at home being socially connected to their community, being able to have non-intrusive monitoring of the patient at home, so that the family can get a green light, yellow light, red light status of the patient at home without being intrusively into the data that's being collected. So the elderly at home or might not want to have their family know what their blood pressure readings are, but to use some type of sensor type information to figure out did mom get out of bed? Did she go to the kitchen? Did she open the refrigerator door? Did she put the dishes in the dishwasher? Or did she get out of bed, go to the kitchen, half an hour later go back to bed and never left the bed all day? So, those would be the conditions of well-being at home.
So it clearly has some very clear real-world applications. Who do you think should be interested in following the progress of this catalyst?
So the telemanagement forum is all about the management of services and being able to utilize the output from the teams that get together to define our standards. But the digital services reference architecture and the digital ecosystem reference architecture are all about how do you define an ecosystem where you can onboard services from many partners and be able to expose those capabilities to build a care at home application or a well-being at home application. So the partners would be the medical suppliers, so the device suppliers, but also maybe the National Health Service as a supplier partner. Maybe the National Health Service is the partner that really wants to have the application built and bring it to market. We worked with Sutter Health out of Palo Alto to define the well-being at home use case. So we were taking input from health organizations to see what are the use cases in that particular industry. So it's the suppliers and the partners in the industry vertical, but it's also the operator and what services from the operator can be used to collect information, monitor information, provide healthcare status. All that the mix of the operator with the partners and suppliers.
And so is there anyone else you're looking to bring into the Catalyst to get involved in the work that you're doing?
So we've been asked many times, when are we going to kind of bring in more healthcare software-oriented products? We haven't had that reach into that market yet, so that's an area we could explore. We could look at other use cases with other partners as well. Our focus for the upcoming Catalyst is to actually apply some of the principles from the DSRA into the solution. So more of a focused on how do we map to what we've just delivered in the past frameworks. In terms of healthcare suppliers, we would welcome more input from the healthcare industry, and are more than willing to add more use cases. But our focus right now is to kind of flesh out that well-being at home and build on top of that a little bit. We also added charging and billing and settlement into the recent Catalyst. So adding more features in that area and showing how we use the billing API. So we're also following, the API program and trying to pull in as many of the APIs as we can into the solution when we do this Catalyst.
And what do you find is the benefit of doing this through a Catalyst rather than just in your own company, for example?
Well, when you do a project, a catalyst, right, you get to test out an area that you might not know if there's a market for it. If you were to do it in your own company, it takes a lot of funding, and then it's a solution, and then it has to make money, whereas a catalyst is a test bed. And you get to do it with others. So as my company, Ericsson, I may not have some of the piece parts that I need to deliver the full ecosystem that we're delivering in the catalyst. So it's nice that you get to work with some of the other vendors that might have a specific specialty that can supply that information. But then you also have the folks that are the operators themselves, that are the champions, who are looking to direct you towards a certain goal. So that's very important because you're getting the real feedback from those champions on what they're really looking for you to provide. So that's valuable input as well.
Okay, thank you very much.
Thank you, Sarah.